3 months ago, a patient came into the office in tears. She no longer recognized the route home after going shopping, a trip she'd made for 30 years. She'd gotten lost 3 times in 1 week. Her husband started talking about nursing homes. Her children whispered the word Alzheimer's. She was convinced her brain was failing, that it was over, that she'd become an empty shell. But when I reviewed her medication list, it became clear immediately. This wasn't Alzheimer's. It was her pharmacy. 5 medications, each prescribed by different doctors, all considered safe, common, routine. Yet together, they were destroying her brain. They blocked a key neurotransmitter essential for memory, slowed her neurons, and starved her hippocampus. The worst part? No one had warned her that the pills she swallowed every night could erase her memory faster than any degenerative disease. What truly angered me wasn't that she was taking the medications. It was that no one, absolutely no one, had taken the time to look at the big picture. Each specialist prescribed their pill. One for the heart, one for sleep, one for the bladder, each in their own silo, each convinced their drug was necessary. But no one saw the storm brewing in her brain. Because what often erodes memory after age 60 isn't always a disease. Sometimes it's a silent accumulation, a chemical overload, a stacking of substances that seem harmless alone, but become toxic together. Hello, I'm a physician specializing in senior health and cognitive preservation. For over 20 years, I've seen hundreds of patients like her, sharp, intelligent, active people who suddenly started forgetting, getting lost, searching for words, failing to recognize familiar faces. In many cases, far more than most imagine, this decline wasn't inevitable. It wasn't just aging. It wasn't Alzheimer's. It was medication-induced and often reversible. Today, I'm sharing a truth the pharmaceutical industry would prefer to keep quiet. I'll reveal how certain medications you might be taking right now, drugs you've been told are safe, can accelerate memory loss, shrink critical brain regions, and push you toward dementia you might never have developed naturally. I'm not talking about obscure or rare drugs. I'm talking about pills millions of seniors take every day without a second thought. What terrifies me most in my practice is how quickly a brain can collapse when bombarded with substances that block its neurotransmitters. Acetylcholine, familiar with that word? Probably not, but it's one of the most important molecules in your cognitive life. It's what lets your neurons communicate. It helps encode new memories, focus, stay alert. It's what lets you remember your grandson's name, where you parked the car, what you ate this morning. A whole category of drugs called anticholinergics blocks this molecule, preventing it from doing its job. When acetylcholine disappears, your memory disappears with it. The problem? These anticholinergic drugs are everywhere in your medicine cabinet, in sleep aids, allergy pills, bladder medications, antidepressants. You take them to sleep, to stop sneezing, to avoid running to the bathroom every hour. Meanwhile, they're quietly eroding your brain from the inside, slowly, silently, without you feeling it, until one day you start forgetting, searching for words, getting lost on the way home. Then everyone around you says, it's just age, it's normal. But no, it's chemical, it's toxic, and often it's avoidable. Let me start with one of the biggest culprits, one almost everyone has at home, diphenhydramine. You might know it from nighttime allergy or cold remedies, often labeled PM for night. That little pink pill you take to sleep, calm an allergy, or ease a cold seems harmless. It's over the counter, no prescription needed, so it must be safe, right? No. Terribly wrong. This is a powerful anticholinergic. It blocks acetylcholine in your hippocampus, the brain region that stores new memories. As you age, your brain produces less acetylcholine naturally, so every time you take diphenhydramine, you're depriving your brain of fuel it desperately needs. A major study followed thousands of seniors over years. Those using anticholinergics like diphenhydramine regularly had a 54% higher risk of developing dementia than those who didn't. Imagine, you take a pill to sleep better and you more than double your risk of losing your mind. No one warned you at the pharmacy. No one told you that little pill could steal your memories. What to do? Stop anything containing diphenhydramine. Check labels. If you see PM, night, sleep, or certain allergy formulas, be cautious. For allergies, safer alternatives exist, like loratadine. It doesn't cross into the brain or harm memory. For sleep, we'll cover better options later, but stop using brain poison to fall asleep. Next, another memory thief millions take daily without realizing: proton pump inhibitors, things like omeprazole, esomeprazole. You might know them from brands for heartburn, reflux, ulcers. People take them for years, even decades, because symptoms return when they stop. But here's what you're never told. By suppressing stomach acid, these drugs impair absorption of vitamin B12. B12 isn't minor, it's neuron fuel. It protects the myelin sheath around nerves and enables fast, efficient brain cell communication. Without enough B12, neurons fade, synapses retract, memory collapses. A large study of over 73,000 people aged 75 plus found regular users had a 44% higher dementia risk. And that's not all. These drugs also raise beta amyloid plaques in the brain, the toxic proteins that build up in Alzheimer's. Double damage, starving your brain of B12 while poisoning it with plaques. If you've taken these long-term, talk to your doctor. Ask about tapering with an H2 blocker like famotidine. It's not perfect, but far less risky for the brain. Try natural options like deglycyrrhizinated licorice to soothe the stomach without blocking nutrient absorption. And get your B12 levels checked. Supplement if even mildly low. Your brain will thank you. Now, a category many take for a common issue: urinary incontinence. Oxybutynin is often prescribed for overactive bladder. On paper, it's convenient. No more hourly bathroom runs, more freedom. But at what cost? It blocks acetylcholine just like diphenhydramine, but worse, because it crosses the blood-brain barrier easily and directly attacks the hippocampus. A study of thousands over 65 found those on strong anticholinergics like oxybutynin for over a year had a 49% higher dementia risk, nearly 1 in 2. Most patients are never warned. They're just told it'll control the bladder, no mention of brain effects. Then they start forgetting, losing words, missing appointments, dropping conversations. Everyone says, "You're just getting older." No, it's medication-induced. Safer options exist. Mirabegron works differently. No acetylcholine block, no brain impact. It treats the bladder without destroying memory. If you're on oxybutynin and noticing cognitive changes, talk to your doctor about switching. Your brain is worth it. Next, one of the most prescribed classes after 60, statins. Simvastatin, atorvastatin, rosuvastatin. Millions take them to lower cholesterol and prevent heart attacks and strokes. Yes, they can save lives in some cases. But here's what's rarely said. Cholesterol isn't just a heart issue, it's vital for your brain. Your brain is about 60% fat, and cholesterol is crucial for myelin sheaths, the protective coating letting electrical signals travel fast. Aggressively lowering cholesterol with statins can deprive your brain of what it needs. A study of seniors over 70 on statins for over 3 years found a 26% higher risk of mild cognitive decline, with higher doses linked to worse declines. Some report sudden memory gaps, forgetting names, recent talks, familiar routes. Terrifying, and often no one connects it to statins. Not all statins are equal. Some, like pravastatin or rosuvastatin, cross the blood-brain barrier less and may pose lower risk. If you're on a statin long-term and noticing forgetfulness, brain fog, or confusion, discuss with your doctor. A dose reduction or switch could make a big difference. Don't let it become permanent. Now, truly dangerous territory: benzodiazepines, lorazepam, diazepam, alprazolam, among the most prescribed for anxiety and sleep in seniors. They boost GABA, the brain's calming neurotransmitter. At first, miraculous: calm mind, no panic, better sleep. But over time, they become a chemical trap, nearly impossible to escape. A study following thousands for 6 years found users for over 3 months had a 51% higher Alzheimer's risk, higher still for long-acting ones that accumulate in brain tissue. They cause chemical sedation, slowing neuron activity. The brain learns slower, becomes less flexible, more prone to confusion, memory holes, emotional numbness. Seniors describe fog, disconnection, not feeling like themselves. Worst, withdrawal, intense anxiety, agitation, insomnia. makes the drug seem essential when it's the source. If you've taken one more than a few weeks, never stop abruptly. It's dangerous. Work with a doctor to taper slowly. Alternatives like buspirone, non-sedating, or cognitive behavioral therapy for insomnia or anxiety can restore calm without wrecking memory. An older but still widely used antidepressant, amitriptyline, given for nerve pain, insomnia, even migraines. Versatile on the surface, but one of the strongest anticholinergics still around. It blocks acetylcholine so powerfully that cognitive effects aren't just possible, they're expected with long use. A large study of over 3,400 adults 65 plus found high cumulative doses over 10 years raised dementia odds by 54%, more than half again. Terrifying. Many patients never informed. They notice forgetfulness, word-finding trouble, concentration fog, but no one links it. Even low nightly doses over years can cause slow, invisible brain power erosion. Damage is silent, no early warning, just gradual decline, mimicking aging, but actually drug-induced. If you or a loved one takes it, discuss alternatives with a doctor. For nerve pain, duloxetine or gabapentin, relief without the same anticholinergic load. For sleep, melatonin or low-dose doxepin, much lighter anticholinergic profile. For mood, newer antidepressants like sertraline or citalopram, generally safer for the brain. One SSRI stands out dangerously, paroxetine, common for depression and anxiety, seems modern, gentler than old antidepressants, but it's the only SSRI with significant anticholinergic properties, making it radically different from sertraline or citalopram. A major review found paroxetine users showed measurable short-term memory, verbal recall, and attention declines in the first 12 months. Seniors on it were 30% more likely to show early cognitive decline than on other antidepressants. Irony, prescribed to stabilize mood, yet it undermines mental clarity and emotional regulation over time. Solution: avoid paroxetine entirely in seniors. It's on lists of potentially inappropriate meds for older adults. If taking it, ask to switch to safer options like sertraline or citalopram. B vitamins, especially B12 and B6, can support mood naturally. Now the most alarming, antipsychotics, quetiapine, risperidone, olanzapine, originally for schizophrenia and bipolar, but now often used off-label in seniors for sleep, agitation, or dementia-related behaviors. Prescribed in nursing homes and hospitals for confused, restless, or hard-to-manage seniors. Consequences devastating. A comprehensive study of over 25,000 older adults found those prescribed antipsychotics for behavioral symptoms were 60% more likely to have worsened cognitive decline in 12 months, even without prior dementia. They also raise stroke, sudden death, severe sedation risks, leading to falls, hospitalizations, permanent institutionalization. Mechanism brutal. They suppress dopamine, not just for mood motivation, but critical for executive function and memory processing. Dopamine crash makes the brain slow, unresponsive. Seniors appear dull, emotionally flat, zombified. Personality fades. Families grieve someone still physically there. Fix starts with hard questions. If you or a loved one takes one, ask why it was prescribed and if it's truly needed. Often, behavioral symptoms can be managed non-drug. Structured routines, reduced noise, overstimulation, treating pain discomfort, better lighting, sleep hygiene. When meds are essential, lower doses for shorter times reduce harm, but too often used for convenience, not necessity. Tragedy. Many families don't know what these drugs do. They just watch loved ones decline, unaware it's chemical, not natural. And now, the #1 hidden threat, anticholinergic polypharmacy. You might expect one drug at the top, but the deadliest risk for memory in seniors isn't a single pill. It's the silent, creeping effect of taking multiple anticholinergic drugs at once. Picture this. A senior takes diphenhydramine for sleep, oxybutynin for bladder, amitriptyline for pain. Each alone might cause mild memory issues, but together, the total anticholinergic load explodes, not theoretical. An analysis of over 280,000 older adults found those with highest anticholinergic burden had 120% higher dementia risk over 10 years, more than double. Worst, most had no idea they were even taking anticholinergics. Blocking acetylcholine from multiple angles doesn't just slow the brain, it starts breaking it down. Neurons atrophy from disuse, synapses shrink. The brain enters a hypoactive state mimicking Alzheimer's. But fixing it doesn't require a miracle, just a medication review. Ask your doctor or pharmacist to assess your full list, prescriptions, over-the-counter, even supplements for anticholinergic load. Tools exist to calculate cumulative burden. Once identified, deprescribe. Slowly taper unnecessary ones, switch to safer alternatives, rebalance brain chemistry. Most exciting part, medication-induced dementia is often reversible. When the burden lifts, many seniors regain clarity, energy, and memory function in weeks or months. The brain is resilient, if given the chance. Back to that patient who got lost coming home. We reviewed her meds with her primary doctor, stopped diphenhydramine, switched oxybutynin to mirabegron, tapered amitriptyline gradually, added gabapentin for pain. In 6 weeks, she regained her bearings. In 3 months, she drove alone again. In 6 months, she resumed bridge with friends, a game she'd quit because she couldn't concentrate. Her husband cried in the office, not from sadness, but joy. He'd gotten his wife back. All without any dementia drug, just by removing the poisons harming her brain. Anticholinergic polypharmacy isn't just dangerous, it's avoidable. That makes it the #1 hidden medical threat to our aging population's minds. You have the power to change this. Take your medication list, ask questions, request reviews, demand explanations. Your brain is precious. Your memory is sacred. Don't let anyone steal it in the name of convenience or routine. Take care of yourself with vigilance, intelligence, and courage.